Unit 4. Khamdy meets Dr. Xaiphone. Unit 4 is about how a doctor diagnoses ASD. The pediatrician, Dr. Xaiphone, physical examination, observation, interview. Tongkham and Chandi finally decide to bring Khamdy to see a pediatrician. There is a pediatrician in the children's hospital in town. A pediatrician is a medical doctor trained to diagnose and treat children. Dr. Xaiphone, the pediatrician, listens patiently to Tongkham and Chandi as they describe their concerns about Khamdy. After that, he checks Khamdy's hearing and other parts of his body. Then, Dr. Xaiphone asks Chandi and Tongkham to play with their son Khamdy. He gives them a few toys and observes what Khamdy does with the toys and how he responds to his parents. After that, Dr. Xaiphone interviews the parents using a checklist. Does your child point using his index finger? And does your child bring things that he likes to show you? Asks the doctor. Dr. Xaiphone asks them questions about Khamdy's development and his behavior at home. Does your child mimic your actions? Does your child turn to look at you when you call him? When you point to something across the room, does your child look at it? Asks the doctor. On his experience and the information that he obtained from the assessment, Dr. Xaiphone tells Tongkham and Chandi that Khamdy might have a condition called Autism Spectrum Disorder, or ASD. ASD is a childhood developmental disorder that affects a child's communication and behavior. ASD affects a child's communication and behavior, exclaimed Dr. Xaiphone. Dr. Xaiphone explains to Tongkham and Chandi that a child with ASD is likely to face difficulties in developing and using effective social and communication skills. Dr. Xaiphone explains 3 pictures in a chart that show 1. Difficulty in making two-way interaction. 2. Difficulty in using gestures to communicate. And 3. Difficulty in making friends with others. Dr. Xaiphone also explains that a child with ASD might show behaviors and preferences that we usually do not see in other children at his age. He presents to them 3 pictures in the chart that show children with ASD. 1. Tend to say the same things or do the same actions over and over again. Tend to insist on sameness. And 3. Some are too sensitive or not sensitive enough to sounds, light, or touch.